What is robotic spine surgery? Does this mean a robot carries out the surgery whilst a surgeon watches, or perhaps isn't even in the room? My name's Anthony Ghosh. I'm a consultant spinal neurosurgeon and director of the Spine MDT. In this video, I'm going to explain what robotic spine surgery is, when it's used, when it's not very helpful, and if you watch till the end of the video, I'm going to explain my personal protocol. A classic or common misconception is that the robot carries out the surgery whilst the surgeon watches. Well, actually, that's not the case. Robotics is nothing more than an additional tool a surgeon can use to help make the surgery that little bit more accurate, precise, and safer. It is particularly useful in the placement of metalwork in the spine, as demonstrated here in spinal lumbar fusion surgery, where a construct of screws and rods are placed in the back of the spine to fix a segment together and allow it to fuse by placing in this cage, a little breeze block that sits between the two bones. So it helps us get the metalwork accurately into the bones of the spine and avoiding various spaces where nerves travel through. Procedures where we're carrying out direct decompression of nerves, such as a microdiscectomy shown here, where we may have to manipulate or move a nerve around, and the fragment of disc here to decompress the nerve, it's not really that helpful. We often need direct vision with high-tech microscopes or endoscopes. So let's take a look at a segment of the spine on this model here. This is a cross section, so up here is the back of the spine, this here is the front of the spine, and then these are the sides. What we're trying to do is get screws into these bones here called the pedicles and enter through the skin into this solid chunk of bone here, and we're trying to miss this middle bit here, this gap through which all of our nerves run through. Okay. Likewise, if we look at the side view, you'll notice a window here at the side, and that's what a nerve leaves through. We're also trying to miss that and get our screw into the bone like so. Traditionally, we would expose the whole of the spine or the back of the spine through a great big incision, dissect the tissue away from the bones, and then expose these landmarks here through which we can place our screws into the spine. Development of minimally invasive spine surgery, we now use X-rays in theatres where we can identify these same landmarks, and therefore through very small incisions in the skin, just wide enough to get a screw through, we can direct a screw through these landmarks into the target area. The problem with X-ray guidance is that it is two-dimensional. So newer systems have been developed known as spinal navigation or image-guided surgery, where a CT scan can be imported into the system. Sometimes this can be taken live during the surgery, and special instruments allow you to see on a screen in real time where the tip of your instrument is relative to various landmarks on the spine in 3 dimensions. Now, robotics uses this image-guided navigation system, but it now holds a robotic arm with a tube in the trajectory you want to place your screw in, and you simply guide the screw down that trajectory tube. Now I'm going to take you through my protocol. We are all built differently. Some of us have wider pedicles. Those are the bony landmarks that we are trying to guide these screws through. If they are wide, they show up really clearly on an X-ray, and I find the standard X-ray guided minimally invasive surgery system better, especially if we're doing a single segment. It minimizes the surgical time under anesthetic, and because we don't always need a CT scan before this procedure and just the MRI scan, overall we can actually minimize the amount of radiation exposure. If that bony landmark, the pedicle in your spine happens to be narrow and therefore difficult to navigate your way through it, this is where image guidance or navigation can be really helpful. And I prefer this to the additional robotics because it allows a bit of freehand navigation and therefore allows me to adjust a trajectory a bit quicker in real time compared to the robotic system. Although the robotic arm will hold the guide tube in a very accurate trajectory, this has to be pre-planned, and it can be difficult or a bit fiddly to adjust that trajectory if you need to. However, if we are placing screws in multiple segments of the spine, which is quite rare, this can help speed up the procedure when moving from one segment to the next and just help reduce that anaesthetic time a little bit, especially in people who have other conditions that can make anaesthesia or surgery a bit dangerous for them. Each patient is unique, and therefore I believe in using each different bit of technology for the right situation. I really hope you found this video helpful, and if so, please click that like button and do subscribe to the channel. Also visit us at spinemdt.com to see how we can help you. Thank you very much for watching.